The advice and opinions expressed by the host of Autism Live and her guests are meant solely as suggestion and should not be in any way construed as child-specific advice. Any choices you make in determining your child's treatment are completely at your own discretion.
Dr. Doreen Granpeesheh is the
Dr. Doreen is an expert in autism.
Doreen Granpeesheh.
Dr. Granpeesheh.
Dr. Doreen Granpeesheh.
Dr. Doreen Granpeesheh is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen. Good morning and welcome to Ask Dr. Doreen. I'm Shannon Penrod and I'm here with the fabulous Dr. Doreen Granpeesheh. She's going to be with us for the next hour answering your questions. Good morning, Dr. Granpeesheh.
Good morning, Shannon. Good morning, everyone.
I'm so excited to be here with you this morning because I love this hour. I love to get to spend this time with you.
We needed it. It's been a week.
Right? It has been a week in so many different ways. And we have a lot going on here at the Autism Network. And I'm always going to be giving you guys updates. And I'm going to do that in just a second. But first, let me say that the chat is open right now. You guys can be writing in right now. Dr. Granpeesheh is a true expert in the field of autism. She donates this hour to give of herself the things that she knows, which is a tremendous thing if you think about it. When I think about the early days of when my son was diagnosed and how much I would have given to just ask someone a question. I had the great privilege of watching you on a podcast last Wednesday.
Oh, that was fun.
Oh my gosh, it was so delightful to just sit and listen. And this wonderful mom, it was her second time doing a live on Facebook. It was absolutely amazing, and you were amazing.
Oh, thank you, Sharon.
And to see this new, fresh set of audience who were like, oh my gosh, this woman is here, and she's actually answering our questions, and she's making sense. Yeah. And she's saying things that are important to us as people and to our kids. It reminded me of how grateful I am to have had the privilege of sitting next to you for so long and hearing what you have to say.
It's amazing. It's a privilege for me to be in that position, but that event was a lot of fun. It was just nice to have a lot of parents asking questions, and it was really a pleasure.
It was really, really lovely, and it made me go, all right, we got to get to more people, because your voice is so important. So I'm really going to ask all of you who, I know there are so many of you who watch and listen and ask questions, to please share this. I've always said, find one person that you think could benefit it, but now I'm going to ask you to find 5. And I'm going to try to find more people too, because I think it's a rarity in this day and age to have this opportunity, first of all, because everybody, in order to have the ability to ask questions, normally you'd have to pay to get into a conference or something like that.
It's true.
We love that we're here in this format. I do want to say that, even though Dr. Granpeesheh has been working in this field for 45 years, still doesn't roll trippingly off my tongue. By the way, Amanda's here with her blue hearts. I'm so glad you're here, Amanda. She's been working in this field for 45 years. I know, get out your abacus. It doesn't seem like it makes sense. But she's a true expert in this field, has been working with everything from very young babies up through senior citizens, and she always is taking the perspective of, let's look at the individuals in this conversation.
Right.
Let's, diagnoses is a wonderful thing, but let's look at the individuals and what their needs are, and that means the individual on the spectrum and the people surrounding them who are taking care of that individual and helping that individual. So even though she has all that experience, there is no expert in anything that can give individual specific advice in this particular format. That's sort of the limitation here. But please do write in. I know right at about, when we have 15 minutes left, everybody writes in questions and we can't get to all of them. So write in your questions early and often. We will do our best to get through as many as we possibly can, but know that you need to be as specific as possible, and that Dr. Granpeesheh will be asking you questions and will also give you an answer that is based in needing more responses that you'll need to take to the person who is close to you. But hopefully, the person who has eyes on the conversation, you'll be able to ask them more informed questions based on the conversation that you have with Dr. Granpeesheh. So start writing in your questions. While you do that, Traven is showing you all the different ways that you can watch the show and listen to the show. Don't forget that we podcast. We're available as a free download wherever you get your podcasts. That is going to be an audio-only podcast, but you can watch the visual on YouTube. There's 12 years of videos on YouTube for you to catch up on and search And we are constantly trying to update that to make sure that the right search words are in there. So if you search our channel, you're going to find, you can just put in Ask Dr. Doreen and you'll find so many. At some point we need to take a count of how many shows there are in 12 years.
Yeah.
But you can also search topics, and that will be really helpful. We really want to remind you that we have this event coming up, and it's getting close. My stomach just went floop because it's getting close. So we're doing something called the Autism Network Podcastathon. It's the very first time that anything of this nature has been attempted.
Right.
That, especially for the autism community. We are on April 4th at 3 p.m. Pacific time. We are going to go live, and we are going to attempt to stay live uninterrupted for 44 hours. So we will stop the podcast on Thursday morning the 6th at 11 a.m. Pacific time. Now, within that, if you go right now to autismnetwork.com, if you're on your computer, there's a box that says Podcastathon, and you can click on that. There's also a graphic that says Podcastathon. You can click on that. If you're on your phone, you can either click on this graphic, or you can go to the three little bars, and there is a subject title that's Podcastathon. When you get there, there will be 3 different boxes there. I really want to encourage you to click on the one that says Calendar by Hour. Now, we are filling in information as we get it, but almost all of it is at least you can see who is going to be there in each hour. I want to go just through the first 6 hours quickly, if you'll humor me.
Of course, that's exciting.
Because this sets the tone for the whole thing, you guys. So first hour is the amazing kickoff, and during that hour, Dr. Granpeesheh and I will be here with, on this set live, Joe Mantegna, Holly Robinson Pete, and Kobe Bird.
Oh,
Isn't
wow.
that a lovely little array of people?
That's amazing.
So everything represented, we've got a mom, a dad, and a wonderful actor who identifies as being on the spectrum. You guys loved him from Lock and Key. We got the whole thing.
That's amazing.
Right? We have Dr. Granpeesheh, and actually we have 2 moms because I count as one too. But anyway, so that's the first hour. We will be taking live. Isn't that a great hour? Then in the second hour, because we know you guys are going to be chomping at the bit, it's Ask Dr. Doreen, and it's straight questions. People around the world will be asking her questions. We're going to get through as many as we can. There will be several Ask Dr. Doreen segments during the podcastathon. Some of them will have a specific theme, but in that first one, we're taking your questions. In the next hour, so that's the third hour, it will be Ask Dr. Doreen, and the entire hour is devoted to anxiety.
Oh, great.
Right?
Thank you. Yeah, I wanted an hour devoted to anxiety.
Yes, I know.
That'd be great.
And so she will be talking to you about anxiety, and we will take as many questions as we can fit in the format. Okay, so in the fourth hour, I will be welcoming Dr. Stephen Shore and interviewing him, and you're welcome to stay for that
He's
if you
a
want
good
to.
old friend. So
Now,
I'd
there
love
is a
to.
possibility of somebody else. We're waiting to see if it jives with her schedule that we might also be having during that hour. Just saying.
Okay.
Much to be revealed. And in the next hour, which is the fifth hour, then it is a full Autism Live hour with Dr. Temple Grandin
Amazing.
on the day that her new book is coming out, which is all about education,
Amazing.
educating individuals who are on the spectrum. And it's meant for people on the spectrum, for their parents, and for teachers. How much do we love that? And then in the sixth hour, and then I'll let you guys look at everything else. In the sixth hour, it is Stories from the Spectrum with your host, Dr. Carrie Magro. So, an amazing international speaker and advocate and amazing individual. So that's the first 6 hours. And if that doesn't make you want to check out everying else.
I know, that's incredible.
Yeah.
Yeah, people have to take off from work during those 2 days.
Well, and I want to say there's nobody, I want to watch all 44 hours at this point, and even I can't, right? Because I'm going to have to get some shut-eye because my hair is going to look crazy, and we'll talk about that in a second too, and I'm going to look a little crazy by the end of the 44 hours. But everything will podcast, so you will get a chance to see it, but I think you should pick the hours that you really want to be there for because you want to be there for the interaction. Yeah. And prioritize those as being ones that you want to be there for. We've got people covered. We have the lovely Alana Gershlovitz is going to be doing a live podcast from South Africa.
That's awesome.
Super love that. Swathi Chatapalli, who's got a wonderful radio show in India, is going to be doing a special show for us. We have 3 different dad takeovers. We have the Just Two Dads, we have the Autism Dadvocate, and we have the Driven Autism Dad. So
That's awesome.
we got the dad thing covered,
Yeah.
right? And many, many, many other podcasts with great experts. 25-year look across the spectrum with Kelly Birmingham and Jennifer Lucera. Dr. Mary Barbera, who does the Turn Autism Around, is going to be with us.
Amazing.
Sasha Long from the Autism Helper. You guys, it's crazy. And in the middle of the night, one of the nights, we're going to show Never Before Seen clips from my comedy show, The Autism Monologues.
Oh, wow. That's awesome.
So-
that's so exciting.
Now, I will say that in the final hour, we're not unveiling who will be here with us, partially because I don't know yet, but even that, it's going to be a surprise. But we do have a thing that Dr. Granpeesheh and I have talked about during the podcast-a-thon. Every hour, by the way, the Ed Asner Center family will be here with us. Taka will be here. They each have an hour. But during the time that we're doing it, each hour, they'll be talking about different charities and things, because there's not just one autism charity.
That's true.
Right? There are lots of autism charities, but the one that we are both really
Very passionate
close
about.
and passionate about, you founded it, Autism Care Today. It's my charity because you guys give grants to people for the things that they want.
That's right.
And one of the things that people ask for a lot are iPads. And to
Yes.
me, this is a huge big deal because it's the ability for somebody to be able to communicate.
Right.
So I had said to you, I would like to be raising money towards iPads.
Right.
So we're going to start very soon, even before the podcast-a-thon, we're going to set up a thing. Because if we raise enough money, and I don't know what that means yet, then I have said that Dr. Granpeesheh will shave my head in the final hour.
Oh, dear.
All for
dear.
iPads. So I already have the clippers. We know I'm capable of it. So
And if we raise money, then we will perhaps be able to select grants live.
oh my gosh.
Yeah,
Well, that
because
never
we
even
get
occurred
so
to me.
many grant applications. It'd be
Okay.
lovely to do that together.
Well, I am all
Before
set.
we shave your head.
Well, I'm all set to shave my head, so let's make it happen. Okay, our topic today, as we start off this show, thank you for indulging all of that, because I think it's important information. Our topic today is autism symptoms. You guys have written in a lot of different questions about what the symptoms are, what they aren't. And I'm going to give one of these, and we'll see if we get to any more of them. Is there anything in particular that I should be looking for if I suspect my younger sister may be on the autism spectrum? She's currently 14. She was diagnosed with oppositional defiance disorder a few years ago when she was 11. When she was younger, she dealt with a delay in speech, and I remember she did not talk until completing speech therapy when she was about 3 years old. She pointed and grunted, but she didn't use words until about 3.5, 4. She's currently a freshman in high school in special education classes, even though the only diagnosis that she's ever received is ODD. She goes to a public school in Kentucky, so there are not a lot of resources around. Sending a hug to the
Yes.
sibling, first of all.
Yeah,
What a
yeah.
great sibling.
What a great sibling to reach out. And it does break my heart. It makes me very sad to read that.
Yeah.
I really dislike that diagnosis of oppositional defiant disorder because to me, when an individual has kind of oppositional or angry behavior, there's a function to it. There's a reason that they're oppositional. And I never, when you call someone oppositional defiant disorder, ODD, people tend to just be very punitive towards that individual and kind of think, oh, this person has anger issues, that kind of thing. And most of the time, when someone is oppositional or angry, it's because they're frustrated, and we really have to figure out why. And it's really important to know that this individual had speech issues, and there is a likelihood, there's a possibility certainly that they are still frustrated and that they don't feel heard. I mean, any of us, Shannon, feel upset. Any one of us would be, upset and frustrated if we don't have anyone in the world that makes us feel heard, right? Like,
Yeah.
no one's listening to me. No one understands me. No one realizes what I need. No one understands the things that are bothering me in this world.
Yeah.
And so that becomes a really important thing. Now, I can't say for sure because I don't know this individual The symptoms of autism, you know, and I'll just start with that, I guess. You basically have to have a minimum of 7 symptoms that are basically in, you know, you have 2 areas, right? One area is the area of what we call social communication. The other area has to do with ritualistic or stereotypical behaviors. And in the area of social communication, it's like every symptom that is listed in the manual, you kind of have to have. And these are things like, okay, nonverbal imitation, nonverbal communication. So lack of eye contact, inability to read facial expression. All of those types of things are communication. We take it for granted, but you know, when I say something to Shannon and she nods, that is a form of communication, and it gives me the green light to keep going, right? And that is, it's little subtle things like that that a lot of folks on the spectrum don't know how to interpret.
Right.
Facial expression is a very important one. And then there's the whole, all of verbal communication, obviously. If I, you know, if I pronounce something in a certain way or my intonation is in a different way, it could mean a completely different thing. Those types of things in communication also are very subtle but very important. And communication, of course, leads to social behavior. So being able to establish friendships, have appropriate social life or social behavior with peers, all of those types of things are also vital to having, you know, establishing relationships with others. And when you're not able to have those verbal or nonverbal skills, it becomes really difficult to interact in any way. So those are some of the symptoms of the social communication domain. And then the other domain is the stereotypical repetitive types of behaviors, which vary really. Some of our kids have behaviors that are very rote. For instance, they might line up their toys. They might have like finger flicking or body rocking or staring at objects that go in circles or staring at lights or all of those types of things. But then there are also more subtle ones like I must have a certain routine every day, right? So kind of obsessive types of patterns of behaviors. And when there are 2 in the stereotypical area and all of the symptoms of social communication, then you receive that diagnosis of autism. It changes based on the severity. What you see changes based on severity. It changes based on age. So if you have a very severe individual, they might not be able to communicate at all. And if you're not able to communicate at all, you will have some challenging behaviors like aggression because you're very frustrated. You might have a very, very obsessive need for things to be in a particular order. And if anyone messes up that order, you will have challenging behaviors because your whole world is in chaos. So it's hard to say if an individual is experiencing, you know, or has symptoms of autism and therefore is experiencing ODD type things or oppositional types of behaviors. Could be something else as well. It could be that they have, you know, pain that they're not able to express themselves. It's possible that they just have a language delay that results in not being able to express themselves. Clearly, when you have oppositional behavior, there's a mismatch in being able to communicate and express yourself. And so, you know, it would be important for that, for our viewer to help the individual get a different diagnosis, maybe go see someone now at this age, and hopefully they can help identify what's wrong.
Yeah, whenever people talk about ODD, you know what I think about, and it's wildly inappropriate, but the women will understand. The men are still going to be scratching their head. But I had a boyfriend in college that if I would get upset with him about something that he did, his response to me would be like, "Are you on your period?"
Yeah, yeah.
And I would go, okay, while it is true that I get a period and that some things set me off even more when I have my period, it's not like having my period makes me get set off for nothing at all.
Yeah.
And I have a right to be upset about when you do something. And it was a diversion,
Yeah.
right? And I didn't end up with him, thank God. right? Right? But it's this thing about, I think when people
Totally.
say somebody has ODD, it's like, oh, well, they're going to just,
They're just going to be angry.
they're just going to be angry and they're going to be opposed to things even that they want. So, okay, we're done here.
Nobody wants to figure out what's wrong.
Right.
Right.
And I think in my life there have been times when I have been so mad that if you had offered me something that I wanted, I still wouldn't have taken it because I was mad about something that was real.
Yes.
Right? And so for me, a 14-year-old who is that angry, because I have heard you say that, you know, those feelings, they don't just go someplace into a vacuum, and that sometimes they turn inward.
Exactly.
And
That's
then it becomes
the concern.
suppression. Right? And you know,
That's right.
I woke up this morning to hearing that, you know, somebody that our family knew, a 24-year-old, has died from their addiction.
Oh.
And it's just like, oh, you know, like what, and you go, oh, what can we as a society do? But then, you know, when you think about a 14-year-old who's clearly in pain,
Yeah.
that I love that this sibling is like, you know, maybe I need a diagnosis in order to get help.
Right.
But I guess what I want to say is let's get help regardless.
Yeah, and sometimes, I mean, I agree with you, but sometimes it's just hard to get help without the
Yes,
diagnosis.
and especially in
because,
Kentucky, yeah.
like, look at this situation. Like, you know, years ago, someone has said this individual has oppositional defiant behavior, and it's just stuck with them, right, for
Yes.
years, and they're in a special ed program. And, you know, maybe it's just that the education system was too difficult for them, or something was too difficult for them, so they, you know, they had defiance towards it.
Or maybe it was too easy.
Or maybe it was
Because
too
we
easy.
see that on
really
a regular
good point.
basis too.
Yeah, yeah,
That they're bored and they got nothing to do.
yeah.
And so they create some sort of drama because at least that's interesting.
Right, right. It's very, so I think the steps to take, and it's amazing of this sibling to care so much, but the
Yes.
steps to take are to, you know, contact insurance, because you probably have some form of insurance that gives you the ability to get a diagnosis or get an evaluation, because I'm guessing the school's not going to really get involved and do anything. They've placed your sibling and they're not going to do more. So I think at this point you need to like find a developmental psychologist or a psychiatrist who can do an evaluation and give you some ideas.
And I also have to say too that, you know, it's just it feels like the system is letting this young person down.
Absolutely.
But it's not to be without hope, because sometimes it just takes one even teacher
Yes.
who recognizes and goes, I see something in you.
Yeah.
Oprah talks all the time about the teacher who said, you have something in you, that you are a great leader. And that no one else saw that, but that
Yeah.
teacher did, and that sometimes, you know, you never know what's around the corner, but
Right.
but don't give up, don't give up.
Don't give up.
All right, we're saying hello to a lot of people. Alicia Hendricks is with us. Hello, Alicia. Wonderful. And, yep, and we see that we have Paula Winton. We've got Amanda Bright, we've got Joannie, we've got Parker, we've got Dark Angel. Taryn is with us. I'm saying hello. I'm told that Traven Hardy's mom is with us. So we love that. Yasmin, and I'm making sure that we say hello to everybody. I know we saw Parker on here at some place. And Andrea are all with us. So I'm glad that you guys are all with us here today. We're talking about those autism symptoms. Andrea wants to know, good morning, ladies. My 3.5-year-old son has been in ABA for 40 hours a week for 6 months. He has only made 2 to 3 months gain on the Vineland. Should I be concerned?
Well, no, I mean, that's wonderful. And I want to say that usually the Vineland is not a very sensitive test. It doesn't go that fast. You don't usually see 2 to 3 months type of progress. Even like, it's just not a very, I don't know how you know this, because it's hard to see a 2 to 3 month change on the Vineland, because it's a much more global measure. But if your child has made 2 to 3 months of progress in 6 months, that's tremendous.
Brilliant.
Especially if it's the first 3 months, because the first 3 months the child is usually just kind of getting used to things like ABA and what are we doing. But you can tell that it's working, and so please stick with it. That's great news. Congratulations, and just keep going. You'll see that it doesn't kind of, you'll see this, and then sometimes you'll have like a massive change. And then you'll have, again, a little bit of a slowdown and then a huge change. It's not like one-to-one correlation. It changes all the time. And as long as your child is learning, you're in good shape.
And think of it this way, too. You said your son is 3.5, and we don't know, there would have been a whole bunch of things that they tested him for to see where he was in those things. I just remember as a parent, when they were testing my son, and they were like, okay, well, he's about to be 3, but on this thing he tests at a year, and at this he's a 1.5 years, and at this, and I remember sitting there being so worried, devastated, and like, oh my gosh. But if you think about it, so if he's 3.5, and let's say that on something he was testing at 2, well, now you just caught up 3 months. That's a lot. Yeah. Because if you're only trying to catch up for, a year, then that means you caught up a lot.
And again, the Vineland again has subtests, right? So you don't usually get like 2 to 3 months overall. It might be but like if it is overall, that means it's an average of all the subtests, and it's important to keep looking at the subtests and making sure there's progress.
Taryn says, hi ladies, my 3.5-year-old is working on interverbals in ABA, which is also brilliant. Will he likely become conversational in the future? How can I help him learn?
That's great, Taryn, and congratulations. It's wonderful that he's into intraverbals. You need to, or your BCBA or whoever is working with your child should just be assessing kind of the different aspects of language that are still lacking. You won't just go automatically from intraverbals into conversation unless you're giving the child all the different tools. So for instance, there's, in addition to building the subparts of speech, so for instance, you might be able to respond to an intraverbal such as, what color is the sky? And the child might say blue. And they're describing something that isn't present in front of them, but they're talking about it, and that's an intraverbal. But what you really want is for them to express things in longer sentences, so you need to make sure they have lots of attributes they've learned, size, color, shape, etc. of objects, a lot of object labels, a lot of action words, and that they're able to put all of these together. If you know the action verbs, then you need to do past tense, future tense. You need to have like pronouns, prepositions, so that you can bring it all together in conversation. And then you need to do all the abstract stuff for conversation, which is things like taking turns. Like if I say something, you respond with a similar thing, or you respond and you ask a question. So there's a lot of different steps to take to get to conversational speech. I really, every time we do this show, it reminds me that I need to write all this stuff out, because very few people have access to a curriculum like skills that would be able to guide them along the way.
But there's this
there is, absolutely. On the back of this book, there's a whole
I'm going to give it to you
set.
The shot is
so
on you.
this is evidence-based treatment for children with autism, which we wrote a few years ago. And at the back of this book it's in the appendix, there's many pages of lessons. And these lessons are literally, like you can see, the language curriculum, the social curriculum, and you'll see in here like conversational speech. And it names the lessons, but it doesn't go into how to teach them. And I think that's kind of what's missing in that, is that I need to put a lot more detail into how to teach those specific lessons. But perhaps if you have a BCBA, you can just tell them, I think we need to work on conversation. He's not conversational. I want him to take turns asking questions. And then they'll put a program in for that.
Wonderful. Dark Angel says, the symptom I didn't recognize was that he was extremely clingy. separation anxiety was too much. I didn't think it was a big deal because he was too advanced for his age. Actually, I thought it wasn't. It cut off there, Dark Angel, but it picks up saying, knowing numbers and letters too young was new to me and loved reading so much. And I think there was one more. My son didn't like playing with children too, but with adults. That those were the symptoms that she saw. I don't think there's really a question there as much as an observation.
Yeah.
That those are the I think, I don't think there's been enough discussion about what to look for parents. I've always said, where is the billboard that says, the top 5 things to look for? And if you are seeing these things, any of these things in your child, and you have questions about autism, here's the 1-800 number to call.
Yeah,
It's
it's
staffed
hard.
24/7. We still haven't gotten there as an autism community.
It's hard because it exhibits very differently in different children. Like a lot of what you wrote, Dark Angel, I can tell you that my oldest daughter also was extremely shy, did not play with others. She just interacted with kids at the age of 3 and 5, with adults, her teachers. They could not get her to go and play on the playground. She's, typically developing and pretty brilliant.
Yeah.
And so it exhibits differently for different kids. But the concept of it is, if you can't access the individual's inner thoughts, let's put it that way. So you're trying to interact with them, they're not connecting with you, they're not responding to the like if I say, if I try to ask a question, they might answer only to me but not to others. If you see those types of things, those are some red flags. It mostly has to do with being able to share minds, being able to interact back and forth and share thoughts. Those are some of the early red flags. But then if you're looking at a younger child, Shannon, the red flags of autism are all in the motor skills area. You wouldn't think of that. But the truth is that when you're looking at, let's say, a 1 or 2-year-old, a lot of the delays have to do with motor skills. One of the very, very early red flags is not being able to point. Pointing is the first expression of joint attention, which is one of the areas we struggle with. So not being able to point, not being able to express themselves, being sensitive, I think, right now, for me, a lot of the younger kids that I see that I diagnose are very sensitive to sensory input, or not being able to respond to auditory input. There's a lot of different ways that it exhibits. Unfortunately, it's hard. It's hard for parents. What I see is most parents come to me when their child is 2 and has not yet developed speech.
Yeah.
And that is, by that time, I think the pediatricians most often will be concerned as well. And then we look at things and we see whether it's just a speech delay or if there's other aspects.
Yeah, it's hard. We all need to cut ourselves some slack.
Yeah.
You didn't know what you know now, so you couldn't have known. So you have to allow yourself that and say,
That's
I
right.
didn't miss this.
That's right. We could do an episode on this, Shannon, because there's a few tests that are very good, like the MCHAT. There's screening tools. They're not diagnostic tests, they're screening tools, and they're actually really good, and we could review them.
Yeah, we could do that. Amanda has written in and said, if you recall, it was a couple of weeks ago that she was saying that she was without services for a while, and I about lost my mind. But she says, we found another center for my son to attend. The BCBA is very thorough, and we are on the same page for treatment planning, which is a woohoo. They're also male, which is great for my 14-year-old son. He's never had a male BCBA. My issue is he's not on their side, on the medical side. He for sure doesn't believe in the gut-brain connection. He just isn't there. Any feedback on how we can politely educate him and let him know food interactions are at the center, are infractions, are at the center are a major deal for us. I know this is like, I'm just going to turn it over to you.
Yeah. So this is a big deal, and it concerns me. It's a little sad. I would, when you were learning about the importance of all the biomedical interventions and diets, you were reading a lot of stuff. So I would recommend that you gift him some of those things that were meaningful to you. Now, there's such a huge library of things that you could read nowadays that talk about not just the gut-brain connection, But I mean, the whole concept of leaky gut and so on goes back now more than 20 years. There's publications for the past 20 years on this subject. An easy place where, if you want to focus on the food infractions, an easy place to find really good articles is if you go on Julie Matthews' website, which is Nourishing Hope. If you look that up, she's got a bunch of stuff on there that you can print. There's also, if you go on the Autism Research Institute website, they have a lot of stuff on there as well that you can print and give him, published, peer-reviewed journals. And then also, since he's a BCBA, tell him when he goes to the next Association for Behavior Analysis conference, ABAI. It's in May every year, and most BCBAs go there. So we have like thousands of BCBAs going because that's where you get all your continuing education and you go to all these different presentations. Make sure that he goes to the one that is supported by my endowment. It's in my name. The Doreen Granpeesheh Endowment funds a biomedical presentation at ABAI every year. I believe this year we have Dr. Tim Bowie, who is a physician, very, very well known. He is at Harvard Mass General Hospital. He's a gastroenterologist, and he will be talking about the gut-brain interaction and how there's, you know, BCBAs often will respect the journal article, the journal called Pediatrics. And years ago, a group of people and we did a series of presentations on it that were published in Pediatrics. There's a really, really good article about how the gastrointestinal, all different types of gastrointestinal issues influence autism and how they interact with autism. So literature, the conference, ABAI conference, and you know, on the Autism Research Institute, you can even watch presentations live because they have a lot of videos on there.
Yeah. But I also want to say,
Education.
I want to say, you know, there is a thing, there is a stigma, and it's ingrained. I just came back from the ABAI Autism Conference a couple of weeks ago, and I was on a panel, and then I said, when the panel was over, that I would stay as long as I needed to answer questions, and I stood there for hours and answered people's questions. And there was one set of BCBAs, that wonderful, wonderful BCBAs, who came up and said, we need your help. We've got a parent who really believes in that gluten-free, casein-free thing, and how do we get them away from that?
I know.
And I said, well, okay, I don't think you're gonna like my answer. And I said, but let me ask you something. You know, were you here last night? Did you go to the bar? Did you have anything to drink? And they were like, well, yeah, we did. You know, I had a glass of wine, I had a drink. And I said,
how did you feel
How
today?
did you feel afterwards?
Yeah.
And did your ability to communicate and function change at all based on what you had to drink? And they were like, well, yeah. And I was like, why do you feel like this child would be any different?
Yeah.
And they were like, well, that's alcohol. And I said, okay, do any of you have any food allergies or any food sensitivities? Because, you know, I'm allergic to wheat. Any of you? And one of them was like, oh, I'm allergic to shellfish. And I said, and so what would happen if you had shellfish? Would your ability to communicate and learn and, you know, cope, would it change at all? Why do you feel that this child is different than you?
Yeah.
And I said, maybe the problem isn't that the mom is holding on to that.
The problem, you know, Shannon, sorry to interrupt you, but the problem is that it's so ingrained, and they will continue to say there's no scientific research, where there is.
Yes.
There's a lot of scientific research. You just have to look at it, you know?
Yes, and I made that point to them too, but I said, let's just all start from the place of looking at this individual, because you have taught me that. Let's just look at the individual. Can we just look at this child? And I said, maybe you should give mom a half of a benefit of a doubt that maybe the child has had a reaction as a result of that, and then, you know, just listen to her. Like, it doesn't stop you from it doesn't stop you from doing the behavioral intervention that you want to do. It means that you can't feed him pretzels.
Yes.
Like, get over it.
Exactly.
I didn't say that, but that is what I want. I said, maybe you should look at it in a different way, because, you know, there are gluten-free pretzels that you can buy in almost every minute. If the pretzels are really the issue, what is the difficulty that you are having with mom wanting to be on a gluten-free diet? Is it that the snacks have to be managed when they're on break, then just manage the snacks.
Yeah.
Like, come on, it's just
Yeah.
not. But and they were like, oh, that wasn't the answer we thought you were. And I said, I told you, you weren't going to really like what I had to
And
say.
this is the other thing, Shannon, that this is actually, it's interesting because the reason that when we built skills, which was also kind of our tracking system,
Yes.
I put in this specific area of skills, which I thought was brilliant. It was my favorite. It was my favorite graph. And it was for this purpose, because a lot of what I was seeing, other people were not seeing. And what I saw was that whenever there was an infraction, there was a change in behavior. And so we had this, all the data that BCBAs take on their iPads, and BTs take, all the RBTs and all the therapists take on iPads or however they do it. When you graph it, and it's always with ABA, it's always a line graph, and it shows mainly two things. Or one is how fast the child's learning, so rate of acquisition, and it's a line graph, and hopefully it's going up over time. And then the other graph is challenging behavior, and those are hopefully going down over time. And when you have an infraction, this graph that I had made, it was called the clinical timeline, you would input infraction just on a day. Today the person had milk, today they had bread, whatever it was, and you would immediately see that those things changed. Like the rate of acquisition went down, the person wasn't able to learn in that few days or a week, and they became aggressive, or some other challenging behavior just suddenly shot up. So we had verifiable proof that these infractions were impacting the individual. And so that's what you tell the BCBAs is, do me a favor and track his behaviors, and I won't tell you. I mean, it's horrible to do that to your own child, but it's like people, they just don't believe it until they see it.
Yeah. Yes, it's a thing. I'm gonna move on and hope that you find the way. But I will say that for me, because I have so many allergens and things, what I eventually did was said to people, this is a food allergy and you have to treat it thus, because then it becomes a legal thing. If you feel like you're not making any headway, just say there's an allergy and so on and so forth. Anyway, Yasmin has said, hello ladies, my 12-year-old son is saying he doesn't like little girls, and especially if they have blonde hair. I'm concerned because when we come across one, he'll stare or point at her, and I'll tell him that that's not appropriate to do. He'll ask why, and I'll tell him because people may get upset. Sometimes he says he hates them, even little babies too.
Yeah.
It's very sad.
Well, it's just one of those things, and I think you just need to figure out why. Either he has made, the first thing that comes to my mind is I wonder, because it's babies as well, and I wonder if he is associating that with a sound, because girls will tend to have a higher pitched voice. Perhaps he knows a blonde girl who screamed or caused him some sort of
or bit him or
something, and he's now thinks that all blonde girls are the same thing. So if you can try to identify if that happened, and even if you can't identify, maybe one of the things you do is you introduce him to, let's say, one at a time, another blonde girl who just comes up and, let's say, gives him a lollipop or just gives him some sort of toy that you've given them, so that he then starts to associate a blonde girl with something very positive, and that will start to change. This is what we call overgeneralization. He's had some experience, or he's seen something on TV, that's also possible, and he now overgeneralizes and thinks all blonde girls are going to be negative because of that one experience. And it's important for him to learn that people are different. And also, don't worry at this point about other kids thinking that's a bad thing or something. It'll pass. I know it's so hard for us because we're constantly worrying about the behavior of our kids and how it impacts other kids, but it is something that he will learn. I'm sure of that.
Wonderful. Parker wrote in and said there's a major problem with diagnosis. There's an issue with girls getting diagnosed less than boys. It's a huge problem that needs to be fixed. We're in total agreement with you, Parker.
I've actually written an article about that. It's because girls are less obvious in their symptoms.
Yeah. Alicia has identified herself as being the parent of the 14-year-old. She says, I can't get doctors to understand her situation. Everyone wants to medicate her. The school only provided her a safe place to go when she gets upset, and I had to fight for that, but good on you for getting it, Alicia.
Yeah,
That's
yeah.
amazing. She says that she is happy to be here, but it is hard when you can't get people to listen to you. I would venture, Alicia, that probably everybody on this chat can tell you horror stories about the fact that, you know, they went to 1, 2, 5, 17 doctors and people weren't listening.
Yeah.
And it's terrifying. It's terrifying, and it feels like, you know, where is the help going to come from?
Yeah.
But I can only hope, if you keep trying, that someone's going to show up.
And Alicia, is she able to express herself when she's getting upset about something? Is she able to express herself before she gets too upset? And is she able to request something, like you got her a safe place to go, that's great, but by requesting to go to a safe place, she's always removing herself from whatever is going on in the classroom. Is there any way that she can gain peace and serenity without leaving the classroom? For example, could she have, I don't know, a short break where she puts on headphones and listens to something calming? Is there some aspect of what's going on in the classroom that causes her to become upset, that she can that maybe we can modify the classroom or the program so that that thing doesn't occur in that way? Like, it would ideally, you know, we try to accommodate kids before a problem occurs, not after. So, like, we don't want to always just take her out when she's getting upset. We want her to be able to express to us what it is so that they can accommodate by changing the classroom or changing her program.
Yeah. Steve has said, hello, I would like to know, when is one in the clear when it comes to regression, or is that something that's always a possibility? It's a great question.
Yeah, it is a great question, Stephen. I think the answer is no. I don't want you to think that regression is always going to happen. Regression will happen to some extent when, if your child is really young in acquisition, so they're in a program, they're learning fast, and then suddenly there's like 3 months of no therapy. So that used to happen a lot. We would fight it because schools used to be our only source of funding, and then when school was out, the child would regress. But if you want to, but that's, even when the child loses some skills, remember, those skills tend to come back fast when you go back into therapy. So it's not like they're lost forever. The other thing is, obviously, if your child is on a diet of some sort and you take the child off that diet, there could be some regression in the sense that they're not able to perform, as we were just talking about it, and they're a little bit spaced out or out of it. Issues like yeast can cause some regression in overt behavior. So there's those things, but no, the older you get, the less there is of that. It's a little bit more volatile when you're younger, and I think it's because you're so actively learning and things affect you a lot faster. So when you're past, let's say, age 10 or so, those periods of regression tend to be a lot less. And always remember, when we talk about regression, it's not like you've lost and you're starting from scratch. They've just been temporarily put out of use, and you can get them back faster, those skills.
Yeah, as long as you're paying attention.
Yes, yes.
For sure. Dark Angel also commented, my son is having play therapy and it's useless. 1.5 hours for 4 days, and I will have to teach him myself. And I get so upset because I see people talking about play therapy, and look, I think I love to play.
Yeah.
And I love using toys to interact and educate, but I get so mad when people try to pass off play therapy as being the be-all, end-all, and that's all you need to do, and nothing else. So I feel your frustration, Dark Angel.
Well, and a lot of times people even claim ABA is, like, they'll say, oh, he's getting ABA, and it's actually all they're doing is play therapy.
Yeah. And or we get the opposite, where they say, well, they do ABA and they don't ever play with him. And I'm like, that's not good ABA either. So something in the middle. And thank you, Amanda. Amanda says, thank you, great info. I have an extra copy of the Taka Journey Guide that I can gift him too. And I'm
Perfect.
like, what a great,
Perfect.
of course Amanda would come up with the perfect
But
solution.
I would be careful with that, because when you're talking to a BCBA, you need to make sure you're providing things that are peer-reviewed, published, because the BCBA will come back and say, this is just the opinion of another mom.
Yeah, you're
So-
right. Joannie, great question. Dr. Doreen, we are so in a great place right now.
Great.
Our 10-year-old son was just re-diagnosed, and we added dysgraphia and ADHD to his list. We are getting his new supports for him in place at school and learning more about both to help him more.
That's awesome.
My concern is that I feel comfortable now. We're okay, but if I don't keep moving the bar, he might not get the best him in his future. Am I crazy? LOL. We are working on bike riding this summer. Anything else, NT, you think that we should tackle for his age? Thank you for all that you do. It's a great question.
First of all, congratulations, and I'm so happy that you're in a good place. And no, it's fine. You know, I know that as parents, we never really calm down 100%. We're always a little bit worried, and that's there's this thing with anxiety, that there's an anxiety normal curve, and a little bit of anxiety is good. Too much anxiety tends to not be good for a multitude of reasons, but a little bit of anxiety makes things go well. So I would say at this time, you know, just try to take care of yourself a little bit as well. Take this opportunity to refresh. But yeah, you're always going to be in charge of making sure that things are going well. And, you know, no one's going to love your child as much as you do. And that is just the way it is. And we always have to kind of keep an eye out. I'm really, really happy that you're in a good place and that you're getting all this support, because those other people who are supporting you are also going to be part of your team that makes your life a little bit easier. So that's wonderful.
But 10 is, correct me if I'm wrong, is that about the age, is it 10 or 11 where you can start the peers program?
I think I thought it was more like 13.
Okay.
Yeah.
All right. So not yet.
It's
Not
a
yet
little
for
bit
that.
later, yeah.
Okay. Stephanie has written in and said, hello from Romania. Thank you for all the information. My
That's
son is
great.
3. He has autism, and we have ABA mostly with me because in our country we pay for this service and it's very expensive. We're all sending you a hug, Stephanie, and amazing that you're getting that done.
Yeah, wonderful. Congratulations.
Paula has written to us and said, just wondering if you have any tips on how to encourage my son and try not to rush his schoolwork. He feels that he is being told off by his teacher when she asks him to take his time. It seems like such a simple thing, but I'm not sure if he understands how to slow down. Is it his ADHD and how he processes information that makes him rush?
So it could be ADHD as well. I mean, it's a great question, Paula, because when you have someone with ADHD, they really do have a very, very difficult time slowing down. So it could be, but you can also try to help him use something like a egg timer, right? Because you have something like you turn it around and there's sand, and as long as there's sand, tell him he should still be working. And make sure that the egg timer is like if it's a 3-minute egg timer, give him something that normally would take him 1 minute or 2 minutes, and tell him while this thing is, you still have time. So that will help calm his anxiety, because anxiety tends to make us rush like this as well. In other words, what you're doing is you're just teaching him to go in reverse, to be a little bit slower with certain tasks. But in the meantime, you know, if he finishes early, he can also spend that time just breathing, calming himself down, enjoying his success, that sort of thing. But it could also be the ADHD.
And I used to teach 7th and 9th grade English, and one of the things that I saw in those grades that I would always have to teach, didn't know it was like an executive function thing when I was teaching it, but I would see, because I used to also help teach people test-taking skills, right? And so with 7th and 9th graders, you have to teach them, okay, this is how you take a test. First, you read the instructions.
Yes.
because a lot of people don't even know to do that.
Yes.
Second, and it doesn't matter whether it's a test or an assignment. First, read the instructions. And if it's the prompt that you're going to write, read it again.
Yes.
Right? Then, organize your thoughts if it's something you have to write, or if it's a multiple choice, answer the ones you know.
Right.
And put a line through ones that you have answered, right? So it's a step-by-step process. But then always, if
Go
you
back
finish, now go back and check all the ones that you weren't sure about.
Yes, exactly.
And if you finish that, so we just had a drop-down list of things that here are the steps that get you all the way to the end.
Right, right.
Because I see kids who just like answer the question, then don't go back ever and check their work.
And they make so many mistakes because of that. I mean, so many of us know, we all know that like tests like the SAT or something, you get points just for putting your name in.
That's right.
And people still miss that, because they're rushing.
And there's always some teacher, I don't want to say idiot, but you know what I mean. Some teacher in high school who will give an assignment that will say, here are the instructions.
Yes.
Write your name and then turn the paper over and put an X and then hand your paper in and you're done for the day.
Exactly.
And then there's a whole bunch of questions afterwards and nobody reads it and they sit and answer all the questions.
Right.
But a bunch of people turn in their papers and everybody turns around and goes, what's happening? Because you didn't read the instructions.
Exactly.
And it's a lesson that teachers do so that people learn, oh, I need to read the instructions. But if you give him choices, then there we go. Now, okay, Alicia says, to answer to your question about the 14-year-old, that they won't allow it. And she says that the thing always comes after.
Yeah, that's the problem. I mean, that's sometimes, if people don't figure out what is causing an issue for a child and they just remove the child from the circumstance after the child has a tantrum or something, then what they're doing is they're teaching the child that the way to communicate to us that you need something is by having a tantrum.
Yeah. I kind of
This
want to
is the
go to your
problem.
IEP.
Yeah.
Because here's the thing: if you have the IEP in place and you and you already fought for the room that she can go to calm
Yes.
down, there's other things you can fight for,
It's true.
and ways that they process it. And then once it's in, if they have a behavior intervention plan and on your IEP it's checked, the behavior intervention plan is checked on that. Now it becomes part of the legal document and they have to follow it. And you can fight for them to have to take steps to do things.
That's right.
It's a fight, it's a slog,
It
it's your
is.
time,
It
it's your
is.
energy, but she's worth it.
Yeah, absolutely. And it's just a matter of really observing the times when this happens. And usually when you observe, you'll be able to figure out, oh, this is what takes her off. This is what caused her to go into that behavior. And how could we, and those little signs are then you take those and you teach it to the teacher so that whenever they see those signs, they actually will prompt her to say, I need a break. Something like that would go a long way for her. It would be really helpful.
And it's cutting off some of the responses here. And so,
Yeah.
Andrea, I don't know when you said you would have to watch the show, I don't know what you're referring to because it's cutting off some of your answers and I don't know why it's doing that. But unfortunately, we are out of time. You can write to me. Any of you can write to me and I will forward things to Dr. Granpeesheh if you want her to know something. My email is shannon@autism-live.com. So shannon@autism-live.com. We really appreciate all the things that you guys are doing in your lives for all the people that you love. Let us just acknowledge that that's a lot.
Honestly.
And that
it
you
really is.
you are enough. And I know sometimes it doesn't always feel like it, but I certainly have seen, and you have so much more experience than I do, but when parents care as much as you guys do, it's always, a better outcome for those kids and those teenagers and those adults. Always.
Absolutely. I always say that with autism, it's always the parents that move things forward.
Yeah.
No question.
So you guys are doing an amazing job and you're asking all the Oh, Andrea says, sorry, that was my fault. I was telling my husband to watch the show, and instead of sending the text, I wrote it on here.
I love that.
I love that. Andrea, thank you for answering the mystery that I was going to worry about all day long, and I find that hilarious, and I love your crying, laughing faces here. I've learned how to text by talking,
Yeah.
and I've sent the wrong text to 3 people this week, and they're like, what? Like, no, disregard.
And I want to, before we end the show, if Traven's mom is still on, I just want to say we love your son. He does so
Yes.
much for us, and this show is really dependent on him, and he's an excellent producer for us.
Amen to that. You've raised a fine
Young
man.
That's right.
And we appreciate. I would be lost in the weeds without
Oh
Traven.
my gosh.
Lost in the weeds. So thank you for gifting us his time. All right, you guys, we are out of time, but we are back tomorrow. We're going to be having a very interesting conversation tomorrow with Julia Ferguson from the Autism Partnership Foundation about a new term that I've been hearing a lot called progressive ABA.
Oh.
And want to talk about what that
interesting.
means, who's coining that term, what it means to whom, and why that might be of interest to anybody. So we will be talking about that tomorrow. You'll want to tune in. Don't forget that we have Stories from the Spectrum on Thursday. And then on Friday, I believe that we are having Let's Talk All the Things with the fabulous Rachel Bird. So, Christy, thank you so much. Thank you all for being here. Thank you, Dr. Granpeesheh.
Thank you.
You
It's always
are
a pleasure.
amazing.
Love you, Shannon.
I love
Thank
you more. All right, you guys, we'll see you tomorrow. Until then, give your kiddos a hug from me and one for you too. Bye-bye for now.
Bye, everyone.
Don't forget, you can watch Ask Dr. Doreen live every Tuesday morning at 10 a.m. Pacific time. We hope to see you there.